Good morning. Thank you so much. What an amazing turnout, and you obviously all went to bed very early last night. I am so delighted to welcome Sarah Woolnough, who is now the Chief Executive of the King's Fund, which, as most of you will know, is an independent think tank working to improve health and care across England. But I first met Sarah when she was Chief Executive of Asthma and Lung UK. I think you just rebranded, hadn't you? Which was a difficult task, I think. Which was a national respiratory charity, and spent 15 years at Cancer Research UK. Actually, like all my guests yesterday and today, their CVs are so long and so impressive. I don't have time to go through it all, but yours is equally impressive. What we want to talk about today, I think, is where we are with the health service, what you would like to see, say, in the first 100 days of any new incoming government, but also what your priorities are at the King's Fund. And I wonder maybe if we could start with that. Your first 6 months there, what have you made your priorities?
Yeah, so nearly 6 months in, fantastic to be at the King's Fund and a great time to join. Lots of colleagues are in a bit of an election bunker at the moment because we're trying to pay very close attention to everything that's said. But I think for the King's Fund, we do a few different things. There's a huge amount of consensus at the moment across the health system about some of the changes that are needed. The King's Fund has heritage and history in publishing on some of those issues, moving care closer to home as one example, integrated care systems. I think we are very keen to push policy into practice in a faster way. So, lots of people are very good at describing problems. How do we highlight solutions, share best practice, accelerate some of what we know to work and where there's good evidence? I think that's point one. I think there is something also that think tanks, organisations like the King's Fund can do, which is bring fresh thinking, novelty, a bit of disruption as well. And so, as an example, where can we learn from the best places in the world to help our health and care system? And then finally, we have a very big, and I didn't know so much about this 6 months ago, learning and organisational leadership and organisational development capability. So we are out in the health and care system every day working with leaders, or we're bringing them into the King's Fund. That is such an incredibly rich resource of insight. We're learning from people. We're hearing, what it's really like on the ground. And so having a really strong feedback loop, playing that into our policy, our research, our insight, I think is one of our sort of USPs and where we can really drive impact. I think finally, my background, I've spent a lot of time at patient-facing organisations working with people and patients. I'm really impatient for them in lots of different ways, and I think I want the King's Fund to be really impatient for change where we can be, and to make sure our vision is to improve the health and care of the people of England. It's very broad. You can work towards that vision in loads of different ways, but we always should keep people and patients at the heart of that. And occasionally, I think lots of us can be guilty of talking to ourselves. Just keeping people at the heart of that is key.
I just wanted to pick you up on something you said there. What is it? What is that barrier to policy becoming reality?
Gosh, that's a great question, isn't it? I don't think, a quick answer, because we could talk for a long time about this. We don't value the infrastructure to help drive change. We don't invest in it. Actually, I've seen over the course of my career disinvestment in it, because when things get really tight across health and care, that's the sort of stuff that goes. But just to make it really practical, I spent a lot of time working in cancer, and cancer has transformed. Cancer outcomes have transformed, and we diagnose earlier, not as often as we should do. Lots of the work that's been done isn't terribly glamorous or hugely complicated. It's changing pathways. It's learning what works and making sure that is spread. And that does take time, people, resource, energy. It's not particularly glamorous or sexy, but you do need to invest in it. And we've had things like the Modernisation Agency, the National Cancer Action Team I work very closely with, and some of that resource in the last decade or so has been cut back or cut away. So it's just one bit of a sort of complicated answer. You need to value and invest in the infrastructure to drive change.
Can we just pick up on some of the stuff that hasn't actually come up so far in the election? For instance, and I know that the King's Fund has done a lot of stuff on this, but on, for instance, public health. What are you looking at? What's the importance? How can we get this more up the agenda?
Yeah, I'm not surprised it hasn't come up that much in the election in terms of the sort of campaigns that are being run by the main political parties. I would love to see, the King's Fund would love to see more boldness, more bravery, a bit more courage in this area. The public support it if you frame it in the right way. We did some public polling recently. More supportive than you would think of a whole raft of measures, particularly if you frame it of children often, or the next generation, but fundamentally helping people make choices a bit easier, healthy choices a bit easier. It's not necessarily the language of banning things or stopping things, but it's the default, it's flipping things. So on tobacco, on obesity, on clean air, on a whole range of areas, I would love to see, and if you believe the polls, you're likely to have a change of government with quite a bit of political capital, go for it early on, or go for it to an extent. And let's face it, if you look at demographics, if you look at huge demands on our health and care system, we heard it from Amanda yesterday, we heard it from Matthew Taylor as well. We're furiously saying the same things, yet we're not really taking the action needed to shift the dial. There is a huge opportunity, and I would encourage the next government to take it.
I was actually just talking to Matthew about this earlier, and is it a government fear of being seen to be critical of the public? You know, if you say we're going to tackle obesity, are you saying to them, you eat too much? It's your fault. Or if you smoke, it's your fault, you should give up. And that's why politicians don't go near enough towards it.
I think some of it's in the framing, but I think politicians worry too much about that, actually. I would like to see them being a bit more courageous. And a couple of examples, I've spent a lot of time working in tobacco control over the years. It's one of the proudest achievements of the previous Labour government to talk about the smoking ban. It's become immensely popular. Nobody can imagine reversing it. There was huge anxiety about how the public would react, the impact on business. A lot of this is perpetuated by lobbyists, industry, people that don't want it to happen rather than the public. Another example very close to my heart, clean air, and seeing Sadiq take less popular measures for the time being, but using some of his political capital, being a bit courageous. I think he's on the right side of history.
Talking about public health, it struck me that COVID actually benefited that discussion, because for the first time people could see public health directors being involved in some of the actions that needed to be taken, eventually on test and trace. And so it helped the discussion maybe start.
I think the discussion is too often really unhelpful. And so it does need thinking about, it needs to be thoughtful. I think some of the framing that's happened more recently about early years and giving people a good start, but it shouldn't be controversial to say we want to give you the tools and shift the environment to make it easier to look after your health. And it really shouldn't be as controversial as sometimes politicians think it is. And some parts of the media, have a play into that.
Yeah, obviously not Channel 4 News. No. But, as a mother of a 14-year-old, I am desperate that they bring in the legislation so that she won't be able to buy cigarettes.
I've got primary school age children. The stat that always shocks me is nearly a quarter of primary school age children will leave primary school overweight or obese. We all know this stuff, that getting into good habits, it's not hard. It is hard to live it day to day, but it's not rocket science stuff. Is hugely impactful throughout life. So more support early in life, really thinking about some of the measures. Hopefully the next government will bring back the tobacco and vapes bill. There is a huge opportunity. I would really urge the next government to be a little bit bolder than governments have tended to be on this stuff. And I think they can reassure themselves from our polling, from other organisations' polling, there's more public support than they think, and there's a trajectory that once you pass these measures, people often get used to them pretty quickly.
I have in my notes that one of the other issues is health inequalities, which is a very broad area. But can you give me some examples of what the King's Fund is looking at?
Yeah, we've done a lot of work in this area over the years. We did publish a report on poverty with the Joseph Rowntree Foundation recently, which is very close to my heart, partly in light of my last job, where we saw just the huge impact of cost of living on people's health. At Asthma and Lung UK, we had a clinical helpline, and we were utterly bombarded with people worrying about heating their homes, worrying about how they would pay for medicines, saying things like, can I use my child's inhaler because I can't afford my own? So the increase in poverty, the increase in destitution, very deep poverty is real. I mean, have we heard a word uttered about that through the election campaign? Don't think we have. But of course that has an impact on health. And so this idea of health in a broader sense, rather than, the portion that the NHS delivers, doesn't get the attention it should do, and clearly needs addressing. And there are great examples of where services are being poverty-proofed, where people are put at the centre. How can we make it easy for people who are on 0 hours contracts, who can't take time out of work to go to a medical appointment? That's the reason they don't show up for their cancer screening. How do we help people in difficult situations access care? But also, how do we say, look, to fundamentally improve health and well-being, this is part of the issue.
I mean, one of the issues that's been discussed is how you make this cross-government. So if it has to be, the DWP has to be talking to the Department of Health, has to be talking to housing. Can you see a scenario where that could happen?
I'd like to see a scenario where that happens. I mean, so often there are these slight perverse behaviours between different bits of Whitehall and different bits of the system, which mean we don't join up to drive this sort of improvement. There is lots of talk, particularly from Labour, about missions and mission-led government and setting up a health mission which would cross and span Whitehall so that you would try and link up incentives and really take a more holistic view of health and care. We know work is hugely helpful for well-being and in income terms, which plays back into health. And we know we've got millions of people of working age not working, in many cases because they're in poor health. So, I mean, as just one example, if we can better work together cross-government in that area, we can drive huge benefits.
I mean, we're here in Manchester, and they've done a lot in devolution of health and care, which is looking at these issues, sort of the cross-government. How do you predict the future on that? Do you think there is going to be more of these devolved health and care areas like Greater Manchester?
I mean, one of the best days I've had since joining the King's Fund, I've been going out on visits to different parts of the health and care system, and I have seen some of this in action in brilliant ways. So integrated care teams working at neighbourhood level, integrated care systems maturing and really trying to focus on their population's health needs. So I mean, I hope so in a way. You know, I hope we can see a maturing of this sort of system working. I do think a real tension that's likely for the next government is going to be a sort of letting go and an empowering systems, which is what at least the last few years people have, has been the direction of travel in rhetoric terms, but how that collides with a new government that is likely to want to show progress quickly on bearing down on waiting lists. And we know the history of that, as an example, is you manage it from the centre, you send very strong signals, you have a default to strong performance management. So I think that's going to be one of the core tensions of perhaps the next administration of can we see system working and a bit more devolution flourish, and how do we allow that to happen when there will be an imperative to show from the centre some movement quickly on some of, for example, our really long waits.
Well, that moves very neatly to my next question. So yesterday we heard Amanda Pritchard describe the NHS as damaged but not destroyed. What do you think?
Yeah, I think, a phrase we've been using is we've got to be realistically optimistic. When I've gone out on visits, you absolutely often see the very best of the NHS, people doing brilliant things, innovating, and so crucially wrapping things around people and patients. But we all know, we analyse every month the performance statistics. We've got many millions of people waiting far, far too long. We were talking about cancer yesterday. That's something I know very well. It's frightening that people are waiting so long between suspecting cancer and having cancer treatment. It's not only frightening and anxiety-inducing, it will affect their outcomes in some instances. So I don't think any of us would pretend there isn't damage done, but I think we have to be optimistic that we can shift this. I think the final point I'd bring in, we published with the Nuffield Trust the British Social Attitudes on Health and Social Care. And this year, the lowest ever level of public satisfaction with the health and care system recorded in the 43 years we've been running the survey. Particularly low versus other years in primary care and general practice, pretty atrocious in social care, but that's nothing new. But I think it tells us something, which is, the public, we all notice it. I go to the hairdresser and we talk about the fact that she can't get a GP appointment. So we're living and breathing a challenging time. I think we have to be optimistic that we can turn things around. The public is the same piece of research. The public is hugely supportive of our model. And when we hear politicians and some others querying the model, that doesn't correspond with what we hear, which is people support an NHS that is free at the point of use, there when you need it. They don't think our system is working at the moment terribly well. They want it to work better, and that's got to be the challenge for all of us, but for the next government.
Hairdressers and taxi drivers, they're a great source of information, aren't they? My hairdresser told me the other day that his friend, who is a consultant and researcher, was leaving to not go to another job, but just because he was burnt out. And that just made me so sad, because he's only in his early 40s, and he's just had enough.
Do you know, we hear a huge amount of this, and it's borne out in the big surveys. One of our priorities is supporting people and leaders. We did, I loved this piece of work, and of course I can take credit for nothing we've done yet, because I'm so new, but we published a piece of work called Follow Your Compassion, where we listened to, it was some ethnographic research, we listened to newly qualified nurses and midwives, and we got them to record diaries and their experiences however they wanted. So we got TikTok videos and voice notes and all manner of insight. And then we paired them with the leadership in nursing and midwifery councils and professional bodies. But what we heard is borne out time and time and time again, which is people not feeling often, and this isn't deliberate, but not feeling supported, feeling as though they're put in clinically unsafe environments because there's not the resource and capacity, feeling it's not psychologically safe to raise issues of concern, that they're living in an atmosphere of fear at times. It's tiring, it's draining, there's burnout, they're exhausted, and they see their friends and their peers earning more money with an easier gig. So we have to keep this front and centre, really address workforce. And yeah, partly it's about pay, but it's about flexibility, it's about culture. And we've got to keep talking about it. And, I very much hope we've got a workforce plan. Any of these plans are only as good as their implementation, so keeping it front and centre is so important.
Yesterday, I don't know if any of you were here, there was a junior doctor in the conversation zone, and she described the night before having been on night shift by herself in a London hospital, paediatric A&E, and on her break, she didn't want to use the room with the microwave in because there were cockroaches and mice. It's those things that make such a difference to keeping, it sounds little, although not being by yourself in paediatric A&E is not little, but it's those things that make such a difference to keeping the workforce. Next government, whichever hue, what would you say they need to do in the first 100 days?
Well, they're going to have a busy in-tray. They have to think about industrial action quickly. They have to think about primary care, workforce, and just how much strain and stress primary and community care is under very quickly. They will soon be thrust into thinking about winter. There's lots of pressing, urgent challenges, but then there always are. So what I would also urge them to do is think about the reimagining that we need to do with our health and care system, and creating the space to begin to put in train some of the building blocks of, what Amanda talked about, what Matthew talked about, what so many of us are talking about, which is our health and care model at the moment is not fit for purpose for an ageing population, many people living with many long-term conditions, that's too acute-centric, that doesn't invest sufficiently in primary and community care, help people stay well out of hospital, doesn't re-enable them, and with a broken social care model at the moment. So to begin to say, yes, there's the urgent and there's the immediate and the short term, but there's a bigger prize, and that is reimagining, rewiring, reshaping our health and care system so that it's genuinely fit for the future.
That's quite a big task. Maybe not the first 100 days, maybe the first 5 years. Are there any questions? I know I've taken up so much of the time, but or any comments on what you've heard? We have some roving microphones.
Thanks, Sarah. I'm a GP of 30 years, and really grateful for you to mention primary care. I think primary care is struggling, has been for quite some time. I think one of the biggest issues that we face is we are the front line, so we're the checkout workers effectively, and we can sometimes find it really hard to say to patients, it's not accessible anymore. And I think I would just make a comment really that actually with a 20% cut in funding for general practice, we're now in a position we're not employing or able to employ the GPs coming through. And I agree with you. I think primary care is one of the 100-day focuses. So it was really a comment just to agree with you really on that.
Well, on that, we published a report, Making Care Closer to Home, that speaks to lots of these issues a couple of months ago. I spent a brilliant day in primary care visiting different GP practices, seeing some, quite frankly, amazing triaging and using fully the allied health professionals that are active and working in so many primary care settings. but the demand is just huge. I spent another day in an acute hospital where the COO said to me, look, we're doing X, Y, and Z, and we've got discharge lounges and, special frailty interventions to get the flow going. But fundamentally, we need to invest more in primary care. The report makes lots of recommendations, but something that's key is that successive governments have said they will differentially invest in primary care, and they haven't done so. And if we're serious about some of this reimagining, we do have to shift where the money goes. We have to shift the status as well, and we have to make sure there's the right support and infrastructure to help primary care change and adapt to population needs. It's a massive issue. It's a big agenda for the King's Fund. And actually, when we published that report, that some of the feedback we got from government was, okay, but how? Kind of tell us more, be a bit more granular. So we're working on a sort of Mark II, Part 2. Primary care estates is a really good case in point. We know that sometimes bigger practices, I hesitate to say the word polyclinics, but these sort of larger primary care settings where you can go and get a whole raft of things done can be very popular and very helpful. As just one example, our state doesn't really support that. So getting under the skin of that isn't easy, but it is important if we're to do this shift, this leftward shift, and make care closer to home a reality.
Thank you.
Any other questions? I can't see any hands now. I just wanted to ask while we were waiting, what about the contract with the public, with the patient, their responsibilities, which doesn't often come up, but how do you reframe it so you're having an inclusive conversation? You're saying, yes, you as the GP have got to answer your phones, you've got to see your patients in a timely fashion, but what's your responsibility to this?
Yeah, I feel very passionately and strongly about this. I think we often say, and I've had loads of politicians say it over the years, we need a different conversation with the public, we need a different social contract. And then we don't really have that conversation. And so one of my examples, and I felt this very keenly at Asthma and Lung UK, the top theme on the helpline for 18 months was people struggling to access primary care. And it plays to, well, there's huge demand and primary care is slightly on its knees. But there was some nuance under that, and that is that, primary care models are changing in loads of ways. We can use our NHS app at times. There's a lot of digital consultation. There's innovation, pharmacy first, and so on. Have we taken the public and people really on that journey of, your care may look different, and your, first point of contact may be different? I think there's a gap. I think because sometimes we tell ourselves, we think that the public at large are fully on this journey. People are living busy lives and they're not thinking about this stuff 24/7. So really investing in, and it does require a bit of investment. This is what we can do, but this is how you'll have the best experience perhaps. And also recognising, people are different and there will be different preferences. And I think, the health and care system still isn't as flexible as it could be around what suits the public and patients. And in so many other areas of our life, we just expect that. And I do think our health and care system has to embrace that a bit more than it has done.
But you're not talking about major reform. We keep hearing the word reform bandied about again.
No.
It's more subtle than that.
Oh, gosh, yes, it's much more subtle. I think it would be a disaster if there is a major reform programme. An absolute nightmare at this point in time. I've lived through in various organisations, every time you restructure, there's paralysis for a period of time whilst the deck chairs are rearranged. No, I think, of course things can be tweaked, but I think what we need to do is invest and focus on the things that we know we need to do. And for example, with integrated care systems, they've had a really rocky couple of years. Born into a storm is a phrase we often use. We've published recently, they're starting to mature and do the things they were set up to do. Let's absolutely not disrupt that too much.
Well, there's a message for all the parties, unless there are is a question from any of you. I can't see any hands, but can I just thank you very much? We'll have in the next hour, we'll see the Labour Party manifesto. We've had the Green, I've lost count now, but we will get an idea in the next couple of weeks. Right, thank you,
Thank you.
Sarah.